So I'm going to start this discussion on COVID-19, protecting the front line, and give you some background on the work that RNU has been doing. And then we're going to bring in Tracy Trahy, RNU staff lawyer, and Tracy will talk about the right to refuse unsafe work and some issues around that. And then joining us following that will be Laurie Upshaw, President of Branch Number 3. And Laurie will speak to us about the importance of occupational health and safety committees and her involvement in some of the refusals of unsafe work that were filed by our members and how they went to the committee. So it's going to be done through a bit of a conversation. I'm going to start at first, and then I'll bring in Tracy and Laurie. I got to get my clicker, which has been thoroughly sanitized since Yvette used it. Okay, so COVID-19 has certainly rocked your workplaces and challenged you mentally, physically, and emotionally. And it won't surprise you to hear that on our pandemic survey, which nearly 1,500 of our members completed, like that's a phenomenal number of our members to take the time to fill out that survey. 98% of members said that their mental health had been impacted by the pandemic. No surprise at that result. Your union has seen the reflection of this. Efforts related to COVID-19 consumed much of our year, as Yvette touched on during the annual report and even Tony referenced in the finance report. The pandemic turned your already overwhelmed workplaces upside down. Work-life balance was challenged like never before. Many of you were displaced and continue to be displaced. There was and still is a lot of confusion out there in the workplace, miscommunication, and certainly a lot of fear of the unknown. We shifted our efforts immediately and put COVID-19 as a priority, and keeping you safe was what we focused on because we knew that was a priority for you. And even though we're some 10 months into the pandemic, there's still plenty of work to be done. I mentioned that in my speech this morning in terms of still advocating for the proper PPE, and I know we'll still see some challenges around communication as we see a number of cases increase across the province. Our Labour Relations team responded to a record number of inquiries from our members. Activity in the MyRNU discussion forum skyrocketed, with almost 600 posts in just 3 months. It's awesome that our members are using the forum, which was great, but that certainly tells us the stress that members were under. We held weekly Facebook Live sessions. We had member emails and frequent MyRNU posts help keep members connected and informed throughout the height of the pandemic. Our social media channels saw record levels of engagement with both members and the public. Our work is centered around your health and safety. Our team continues to drive advocacy efforts to keep healthcare workers safe in this province. But we couldn't have anticipated that ensuring you get the highest standard of personal protection equipment would be such a battle. Achieving appropriate PPE, safe workplaces with engineering and environmental controls, safe practices, policies, has been a long and challenging mountain to climb at times. Linda mentioned about the advocacy work that we did on PPE, and it was quite shocking when we started to get numbers from the employer to know what position we were in terms of not having PPE for longer than 8, 9, 10 days, and depending on the burn rate, if our cases went up, that we would run out, and which was one of the reasons why there was so much effort in the beginning around having small clusters and small groups of people and public health measures, because we knew we did not have the PPE that would be able to handle surges. We have been advocating for the precautionary principle ever since COVID-19 started, because we knew the scientific evidence wasn't clear. And that has been quite frustrating. I mentioned that to Linda in terms of her work that she did on the federal government level and the work that was happening in the province. I mean, we just wanted them to use the precautionary principle until we knew for certain. Can't we just give people the maximum PPE to make sure that they're safe and that we're not in the position where we go through another SARS? Many assumptions were made about COVID-19 at the beginning that have since been proven incorrect, which only speaks to our message about the precautionary principle. We continue to see the science evolving. We see data coming from other parts of the country where healthcare workers were facing a higher risk of infection. An inquiry out of Quebec just last month found the risk of contracting COVID-19 for healthcare workers was about 10 times greater than the general population. 10 times greater. And compared globally, Canada's rates of infected healthcare workers are quite concerning. And that's not something to be proud of as a country, that we have more healthcare workers infected in Canada than anywhere else around the world. We maintain our position that you deserve access to the highest standards of protection until the science is certain. It took a huge amount of consistent effort and advocacy to get government and RHAs to a place where they would agree to discuss a joint statement, let alone sign one. But we finally got them there, and the statement was signed with ourselves and other public sector unions that clarified PPE standards for healthcare workers. RNU took the lead on this joint statement. Thanks to your help, over 2,000 emails were sent to government about the importance of access to the appropriate PPE. So we were pressuring at one level, and our members, through your advocacy and your emails, were pressuring at another. I had numerous conversations with Premier Ball, with the minister, with other officials at the department and the regional health authorities. Through media interviews and social media, we kept pushing the importance of keeping our healthcare workers safe. And finally, we were successful in signing a joint statement that recognized the critical importance of respecting the healthcare workers' point-of-care risk assessment. The joint statement recognizes that you know best. You're the frontline healthcare worker who's caring for this particular patient on this particular day, and it should be your judgment and your assessment of that patient to determine what level of PPE you need. Although we have fared well in this province compared to many provinces, at least up until a week ago, this is not the time to start slowing our efforts. We've learned from members directly and through our research that some of you are still struggling to access the appropriate PPE. Our pandemic survey revealed some concerning findings. 25% of members are not confident that a fitted respirator will be available should they require them. 25%, I mean, that's a quarter of our members. 27% have been pressured not to use the PPE they feel is appropriate. And 5% have completed a point-of-care risk assessment and been denied access to the PPE they feel they need. This amounts to 68 times when a member has been denied PPE in violation of our joint statement. Now, that might seem like a small number, But can you imagine if, as a result of that, 68 RNs got infected and then they passed on the virus, and then you work out from there and how many people then they would infect, and then the other people would infect, and you can see the contact tracing and what that would look like. So even one person being denied is one person too many. It's simply not good enough. Tomorrow we will debate a resolution about a path forward, keeping on doing what we've been doing, advocating for access to the appropriate PPE. To keep the pressure on employers and government, we will be accessing or releasing the key findings of our survey to our members, and we're also going to send them to employers and the government in the next couple of weeks. We want them to know what registered nurses are saying around the efforts that they have put in place. And we are pushing education and communication right down to the frontline manager level. So they are aware that the joint statement is really clear that healthcare workers must have access to PPE, including N95s or other approved fitted respirators, if they ask for them as a result of their point-of-care risk assessment. Next week, we are meeting with provincial IPAC team to express our disappointment and urge RHAs to respect the joint statement. And you know what? If they don't, if we keep having to fight these battles in boardrooms and meeting rooms and on Zoom with employers and officials of the Department of Health, then enough will be enough, because we'll be taking our concerns to the media. And that is something that we don't want to do. I mean, we're fighting a global pandemic here. We want to be working together with our employers and with government to keep people safe. We don't want to be sending a message that the people, government and employers, are not keeping healthcare workers safe, because that will lead the public to feel that they're not safe as well. And that's certainly not where we want to be. And as part of the messaging that I have put forward to the minister, he doesn't want us to have be having arguments at bedsides with our managers. And he certainly doesn't want me talking in the media about employers not doing their part to keep our members safe. So I do want to take a few minutes to walk through the joint statement and how it is and should be practically applied to your workplaces. And then I'll bring Tracy Trahy in, who will talk about your right to refuse unsafe work, and then ask Lori to join us to talk about the Occupational Health and Safety Committee. So, I'm not going to read out the words on this slide, but this is just an excerpt. There are really 6 standards in the joint statement, and this first one talks about balancing between the precautionary principle and preserving supplies. And we recognized that at the start of COVID-19 when our PPE supplies were so low. I mean, we were having conversations about re-sterilizing N95s, about using outdated N95s. I mean, we had fallback plan for the fallback plan for the fallback plan in case we ran out of certain pieces of equipment, because we knew there had to be a balance. But now we're in a pretty good place in terms of our equipment. So I'm going to just review the most important standards here, starting with Standard 2. And this standard really talks about education. Education of staff on the virus, on when to wear the equipment, on donning and doffing of PPE. And our pandemic survey showed that 90% of our members have received training on donning and doffing, and the majority of that 90% rated the quality of that training as high. And that's a really positive result. It's a positive result for our members, but it also is a positive result for our employers. They have done a good job at educating our members on donning and doffing of PPE. Standard 3, and it's the bolded statement in this standard that I want to draw your attention to, because, and this is probably the most important statement in terms of access to PPE that you should be aware of. Because this statement clearly states that you will not be unreasonably denied PPE by your employer. It's all based on your point of care risk assessment, and you do those assessments every single day, not just for COVID-19 patients, but for every patient that you're caring for. You do so by evaluating the likelihood of exposure to yourself or others based on the specific task, environment, and patient that you're caring for. And PPE should be selected based on the findings of your own individual point of care risk assessment for every patient that you have an encounter with. And some of the things that you look at, and I think you should be considering, are things like, is there potential for exposure to bodily fluid like respiratory secretions? If the patient doesn't have a cough, low risk. Is the patient compliable with directions? So if you can talk to the patient and say, now I want you to keep your arm, if you're doing a swab, say, I want you to keep your arms down, I want you to hold still, all those types of things, the risk is low. However, if you have a patient who's confused, is coughing a lot, and is putting their hands over their face, and they're not keeping them down, and then they're touching you, and they're wiping you all over, you can see how risk goes up. So that's how, individual your assessment needs to be. And then looking at things like what engineering and administrative controls are in place, like what about ventilation? If you're doing the swab outside, there's more ventilation than if in someone's home, they're bedridden, and they're in a tiny bedroom that's 8 by 10. You can't open the window, and so risk is higher in that likelihood. So if you complete your point of care risk assessment and you deem that you should wear a higher level of PPE for this particular patient and this procedure, the only time, in our opinion, that it should be denied is if we're running low on supply. Otherwise, we should always err on the side of caution and wear the appropriate PPE for the patient that you're encountering. I'm going to move over Standard 4 and go to Standard 5. Standard 5 talks about airborne precautions, and the minister mentioned this morning. And Dr. Tam, in the last couple of weeks, has talked about new evidence on how COVID-19 is spread. And they're talking more about airborne, which is, and the minister talked about, as a result of that, they're having to review the guidelines that they have in place in this province. So part of Standard 5 is outlining a list of recognized aerosol-generating medical procedures that will and should generate aerosol droplets, and when individuals should be wearing an N95. However, since we signed this joint statement in the spring, there's been a whole lot of changes. And screening measures have changed, engineering controls have been strengthened, and of course we had a lower prevalence period for a period of time, so we started relaxing, right? Relaxing the precautions. Well, now I'd suggest everybody is starting to do this again and get a bit anxious. But no matter how prevalent it is, how many cases we have, whether we have 1 or 5,000, you as a registered nurse should be doing your point of care risk assessment for every single one of those patients that you encounter. Don't let your guard down, because it is your point of care risk assessment that will keep you safe. Standard 6, this talks about PPE supply, and I would like to acknowledge the great work and collaboration that has been in place between unions and employers and government around PPE supply. Some of our counterparts across the country are getting no information, whereas every week we're getting, line by line information around how many gloves do we have, every different type of glove that we have, what is our burn rate, how many do we have in stock, and how many are on order. So we can project out in terms of our PPE supply. So, a real credit to those that are involved in this aspect of COVID-19, because they have been very transparent with unions and associations. So that's what I wanted to say in terms of a background. And now I'd like to bring in Tracy Trahy, our staff lawyer. And Tracy is going to join us by video, I do believe. So we can have a little conversation around some of the challenges that our members have faced, in particular around the right to refuse unsafe work. Oh, there's Tracy. Hi, Tracy. Thanks for joining us. Can you hear me? I guess not. Can you hear me now?
Good afternoon.
Oh, you can hear me now. Perfect. Thanks, Tracy, for joining.
How are you?
Oh, I'm doing great.
Happy to be here.
Great.
I can hear you perfect, yeah.
Awesome. So I've just gone through all the work that we've been doing, the Royal We, collective Royal We on COVID-19. And I'd like to ask you a couple of questions in terms of what you've seen and our staff have seen around PPE. So maybe we'll start with that question. What sorts of concerns were brought to our labor relations staff about personal protection equipment?
Lost her.
Oh, you lost me. Have we got me back again?
Can't hear you.
Oh, dear.
I can text her the question.
Can you hear me now?
I can only hear you faintly.
Okay. So
it's breaking up.
It's breaking up. Okay, so you have the questions, correct?
I do, yes, yeah.
Okay, so you go ahead with the first question in terms of what concerns have been brought to RNU staff.
Okay, absolutely. And if you have problems with my audio, please let me know. So first and foremost, obviously, there's been a lot of fear and confusion amongst our membership starting in the spring when the pandemic first hit. We've received our fair share of concerns from members with respect to not having access to appropriate PPE. So the main concern that I'm actually aware of would have come from our community health and our public health members who basically were denied access to an N95 respirator or equivalent when they requested same. A number of times these requests were linked to home visits. So the member assessed that they were going into a home to see a client or patient, and they determined that they needed the N95 or equivalent, and management refused to provide that particular PPE. As a result of that, we did have members exercise their right to refuse unsafe work. Most of those examples actually link to two main concerns. So the first concern that we saw, and maybe we'll continue to see, is that the PPE supplies were literally locked up and our members did not have access to actually get the supplies themselves. So that's concerning from our perspective, as it's not consistent with the joint statement, which clearly specifies that the PPE should be accessible to all members. If it's locked up, it's not accessible. And that's just not acceptable from our perspective. The second main concern that we saw arose was with respect to employers not respecting the point of care risk assessment. For example, we did have managers actually refuse to provide PPE despite the member going to the manager and explaining their point of care risk assessment and what they've deemed appropriate as PPE based on that. And as you've indicated yourself, Debbie, we saw through our pandemic survey that there was actually 5% of members reporting that they were denied appropriate PPE following their PCRA, which clearly is not consistent with the joint statement and not something that we can accept on a go forward as well.
Okay, great. Okay, go ahead. You keep going.
Go ahead. Okay. The other thing that I think we should address is what do we do if members encounter trouble accessing their PPE? And then, of course, what considerations they need to keep in mind when they're doing that. So first and foremost, when members have requested specific PPE based on their own point of care risk assessment, I'm going to ask that you hold your ground because you may be met with resistance depending on what you ask for based on your PCRA. So hold your ground, communicate your need clearly to your manager or your supervisor, and provide your rationale for requesting specific PPE that you are requesting. If that individual refuses your request, and then of course you continue to need that PPE, then what I'm going to ask you to do is to reach out to your local RNU volunteer or to your LRO at provincial office so that these individuals can provide you appropriate advice and advocacy to assist you in obtaining, hopefully, the appropriate PPE. In terms of considerations when you're going through this process, first and foremost, I want everybody to understand and to recognize that all workers in this province, especially healthcare workers, have the right to refuse unsafe work. And this is a legislated right. Secondly, I'd like to note that if you are exercising your right to refuse unsafe work, that it should be done after your point of care risk assessment that is conducted, obviously, on an individual basis in a specific circumstance. And then, of course, once you've been denied the PPE that you have requested. Unfortunately, refusals of unsafe work that would be done on hypothetical grounds are not likely to be successful. So I can't stress enough that the PCRA is the vital component when we're looking at the appropriateness or the reasonableness of exercising a refusal of unsafe work. And that is, I guess, the standard that any worker in this province and across Canada, quite frankly, has to meet, is that the refusal has to be reasonable. And I am going to suggest that can only occur following an individualized PCRA. So that's very important to consider. I think the third point, Debbie, that you wanted me to go through was basically the overall process and what that looks like when one determines that they are going to exercise their right to refuse unsafe work. So under Section 45 of the Occupational Health and Safety Act, as I've noted, every worker in this province has the right to refuse unsafe work, provided they have reasonable grounds to believe it's dangerous to their health or safety or to the health or safety of another person within their workplace. So that's just the basic tenet. I will say the right is not absolute. That means that it is somewhat restricted. So, for example, under the legislation itself, any worker has the right to refuse unsafe work until remedial action is actually taken by the employer to the worker's satisfaction, or the committee or the worker and health and safety representative at your workplace has actually conducted an investigation into the matter and determined or advised you to return to work. Or thirdly, an officer, and that would be a service NL officer, has investigated the matter and advised you to return to work. So those are the restrictions on the right of refusal. As a first step in the process, when you determine that you are exercising your right, you are obligated to immediately report that to your manager and to your supervisor and to provide a rationale for that. Where discussion with your manager proves to be unsuccessful, and of course you're denied appropriate PPE, you should then, the next step in the process is to contact the Occupational Health and Safety Committee at your workplace and to formalize your refusal. All of our RHAs, all of our employers have these committees established, and contact information for those committees can be obtained either through your manager, through the employer intranet, or through an Occupational Health and Safety Bulletin Board, of course. The committee will, of course, receive any right of refusal that has been submitted. They'll review it, and then they will advise you of their recommendations. In the interim, and this is very important to note, your employer is obligated under the Act to provide you with alternate safe work. Where the Occupational Health and Safety Committee does not support your refusal and then directs you to return to the workplace without addressing your actual concerns, the third step in the process, potentially, is to report the matter to Service NL, the Occupational Health and Safety Division of Government, or to an officer thereof. And that can be done, of course, orally or in writing, although I'd strongly encourage you to do so in writing. When you are exercising your right to refuse unsafe work, I'd also suggest that you highlight your point of care risk assessment, and then specifically identify the factors which, with either the patient or the client, the environment, as Debbie mentioned earlier, that ground your specific request and are cause for concern. It's important to then demonstrate how the particular PPE will actually address any concern that you've raised. The division or the officer will then, of course, review your matter and make a determination as to whether your refusal was based on reasonable grounds. So in so doing, they will not only consider all of the information that you've provided, but they will also consider current recommendations and directives from the World Health Organization, from the Public Health Agency of Canada, from the Newfoundland Labrador Chief Medical Officer and her team, as well as the position of the employer and any information they've put forward.
Okay, Tracy, can you hear me?
Yes, I can.
Okay, perfect. I'm going to bring Lori into this conversation now because I'm very mindful our time is running short and I want to make sure Lori, oh, there she is. Look, right on cue. Hi, Lori, can you hear me? I can't hear you, though. Oh.
Can you hear me?
Oh, yes, you unmuted yourself. You're good.
Yeah. Okay, good.
Okay, Lori, I know we were going to do a back and forth and have some conversation. And I want you to talk about, and Tracy has really set you up very, very well here in terms of the Occupational Health and Safety Committee. We've got about 10 minutes to have a chat.
Okay.
So maybe we can start by you sharing with the group, you know, some context around what is an Occupational Health and Safety Committee and how you got involved in the Occupational Health and Safety Committee in Eastern Health.
Okay, so I guess simply put, an Occupational Health and Safety Committee is responsible for ensuring that the site that you work at is a safe place to work. So we monitor the health and safety of employees, and the committees are comprised of at least 50% non-management. So as part of that, most committees are represented by different unions. So they have, you know, representation from all these committees. Even if we meet and we don't have 50%, if we have more managers show up, they actually will ask the manager to leave the meeting so that we have at least 50% of those people non-management. I am involved in 2 occupational health and safety committees, one at Mount Pearl Square and one at Health Science.
Okay, so if you've been through those committees, you've been involved in some of the refusals that have come to the committee in relation to COVID. Can you share any examples and what that was like and how you worked through them as a committee? Just give us some sense of, from a committee member's point of view.
Yes, I was involved with the ones on the community side. That kind of started off, I guess, in the CBS community health. And then I guess in total, there were 35 nurses who refused work because they weren't provided with an N95 mask. And as Tracy said, it was most of those were related to taking swabs in the home. And as she went through the steps, I mean, it was kind of exactly like it happened. You know, you speak to your manager first, identify why you're refusing the work, and it was unresolved. And then those employees put in writing letters to our committee members. Then we met and we discussed their reasons and rationale for refusing work. We had a really good discussion. We talked about the Campbell Commission. We talked about, the precautionary principle. And in the end, we supported those employees in their work refusals, as did the other, I think, 3 committees that were involved with the other nurses. And our recommendation was basically that a point of care risk assessment. So we made those recommendations, and then they ended up going to Service NL. So the occupational health coordinator ends up presenting the employer side and the employee side, and then it's presented to Service NL and government. And that's where it went from there. So, it was followed the exact steps that Tracy went through.
Is the investigation, you mentioned the investigation that your committee did, how much outside resources did you access? Tracy mentioned, they might consider, what the Public Health Agency of Canada is doing or what the Department of Health here is saying. Did that happen at your committee level as well, where you looked at all those external pieces of information that might direct your position on a refusal? Yeah, kind of, because the employer had sort of their rationale and what the current, what their current science was, what they were using to support their reasons for, not supplying the mask. And but I said we didn't have a lot sort of on the other side. It was mostly the the employee side. We had about 24 hours, I think, to make our decision. So we had to kind of have it in. It was pretty quick. It was like we got together and it was like, okay, we have to make a decision, and then we had to compile our recommendations and then email those as well to the coordinator for OH&S. So it was a pretty quick process. It was a pretty intense meeting for a little bit, but we supported those employees. Were there other, I know these were RNs who refused, or maybe there were other workers beside registered nurses who refused in terms of the N95. Were there other occupational health and safety issues that got to your committee for investigation related to COVID-19 beside N95s?
Yes, absolutely. In the early days, as you know, everything changed rapidly every single day. And I know in the early days, we had people come to our committee advocating for the wearing of masks in the workplace. And I remember having a conversation on a Friday about that and, getting pushback actually from that side of it. And then by Monday, we were actually, it was changed again. We were wearing masks in the workplace. So it was a very rapidly evolving thing. One of the really big things that we dealt with was the protected code blue. And a lot of nurses expressed concern. We're used to we're save lives. We run in and we had to do a lot of things, move patients. I know in dialysis, for example, patients are in chairs. There's only 2 isolation rooms. The patient had to be moved. And there were concerns raised about the safety of doing that in a really fast and efficient way without causing injury. So we had ergonomic assessments done, and there was a bit of a process there and meetings to try to do that in a safe manner. Fit testing was really big. There were a lot of people that were outdated on their fit testing, and there were people that were, wanting to get done, and there were priority areas. But the mass volume was hard to get through, and so we had people come to our committee with that. I think it was like 7,200 fit tests that they did. Eastern Health did in the last while for this. I know some of the clinic areas that were open units were concerned about the lack of social distancing with their patients. So we ended up having IPAC get involved, as well as occupational health, to go in and set up, parameters and what they needed to do to provide care in a safe manner. Another issue was a security issue. Is I guess visitors and the people weren't allowed in. Some of the staff had faced aggression even in the workplace. And I know a lot of people think about occupational health and safety as, slips, trips, and falls and equipment issues, but we also deal with aggression and violence in the workplace. And some people don't, think of us in that regard, but it is really important. One of the things that I did want to mention is that the peers reporting system is really, really important, because when you document something in peers, it's the provincial incident, provincial incident employee reporting system. That's it. Anyways, it goes to the coordinator and everything is investigated. So that's your way of documenting these issues. So it could be something like a visitor is giving staff a really hard time, and you need to have that addressed. You talk to your manager just like you would in a work refusal and see if you can get it resolved. But if not, you can come to your committee, and you do need to document those things in peers so that they can be looked after and brought to the attention of the OHS coordinator. So I think that's about all I had on that. Okay.
Okay, so our time is getting pretty short. And so I'm going to have to clue up there, but that was a great segue, Laurie, into one of the questions I was going to ask you was around, we're bringing a resolution to convention tomorrow in terms of RNU doing more education with members on the role of occupational health and safety committees. And I think your comments there really shed light on the fact that a lot of our members really don't know what the committee's mandate is, and it's not just about slips and falls. It's so much broader than that. And it could be a really good reporting mechanism and a way to have issues addressed through different channels than what our typical channels are in terms of a grievance or professional practice. So thank you for that great lead-in, and I'm sure we're going to have some good discussion around the resolution tomorrow. So thank you, Tracy and Laurie, for joining us. I really appreciate what you've offered, and I know we've had a couple of comments saying, this is really good information for our members, because understanding that whole process of refusing unsafe work and what I guess criteria you have to follow in order to make it a sound refusal under the legislation, and then the role of the Occupational Health and Safety Committee in terms of taking refusals or issues and investigating them, and being done both by employees and management. So thank you very much for participating. It is now 3 o'clock, and so we're going to adjourn